En los últimos datos disponibles
In the last
en relación
data
al hambre y a la
available
malnutrición,
in terms of malnutrition and
realmente no
hunger,
son nada positivos y halagadores.
I can say that
México y América Latina
data is
se
not
alejan del cumplimiento del
pretty.
objetivo de hambre cero.
Latinamerica is
El número de personas
far away from our
subalimentadas
objective.
aumentó por tercer año
The number
consecutivo,
of malnutrition,
llegando a
the figures
39.3
increased
millones.
to
Hoy más que
33
nunca es preciso
million people
que
with
sumemos nuestros
malnutrition.
esfuerzos para
We need to
revertir el
join
retroceso,
our efforts
reanudar el camino del
so that we
progreso
can
y
make
asegurar
some
la
progress
plena
in this
realización del
area
derecho de la
and to
alimentación.
ensure the right to
La malnutrición
food,
es uno de los
access to
principales
food.
problemas a nivel mundial,
Malnutrition is one of the
el cual
main
requiere
problems at a
acciones
global level
inmediatas y
that require
sustentables.
immediate sustainable action.
La mujer en la nutrición
Female
tiene un rol
in this
crucial
topic
derivado en la
has a
mayoría
crucial
del
role.
mundo este tópico tan importante, que está ligado precisamente a
This
la
role
cultura,
is linked to
a
the
las
culture,
costumbres
to the
y
traditions,
prácticas de la alimentación,
and to the
crianza
feeding
de los hijos,
practices,
entre otros,
the
siendo
raising
actividades
of
donde la
children,
mujer
among
ejerce una
others,
influencia
where
que
women
pudiera
have a
cambiar el
strong
futuro.
influence that could actually shape and
Desde el
change
gobierno se han
the
implementado
future.
en México desde
In the government,
1922
since
políticas
1922,
alimentarias tendientes a
we
asegurar la
had
producción de la distribución
policies
y el
regarding
alcance de las
access to food
poblaciones más
and nutrition,
vulnerables.
especially
Es a
for those
partir de
communities that are the
1975
most vulnerable.
cuando el programa y política se dirigen
In
a obtener educación
1975,
nutricional,
we also had
vigilancia del estado
politics,
nutricio en poblaciones especialmente
policies
vulnerables,
addressing
como en
these
el
vulnerable
embarazo y la
sectors,
niñez.
as well as
La distribución de
pregnancy and
suplementos
childhood.
es más notoria
We
de
have
la
the
que antes
effects.
había
We can see the effects
de
of malnutrition
1975.
after, even
En el
after these policies
2012
of
convierten esos
1975.
programas en
In
Progresa, lo
2012,
cual atendía a
these programs
2.4 millones de
were
hogares,
addressing
de los
2.4
cuales
million
2/3
households,
partes
where
eran
3/4
comunidades indígenas.
were indigenous
El
communities.
programa se transformó a
The program
oportunidades y
transformed
aumenta
into
su cobertura a
opportunities
los 32
and covered
estados del país,
32
alcanzando
states
así
of the
los
country,
4.2 millones de
covering
hogares.
4.2
Existen
million
otros grupos
households.
de programas
We have
que son
other
más
groups
pequeños,
of
como el
programs that
programa
are
de apoyo
smaller,
alimentaria,
like support
suplementos de
of
vitaminas y
nutrition,
minerales,
supplements,
programas del
and
DIF,
vitamins and
grupos de
minerals,
despensa, cocinas populares, liconza,
food,
arranque
popular
parejo a la vida,
kitchen,
etc.
etc.
La desigualdad contribuye al hambre
Inequality
y a las distintas
contributes
formas de
to
malnutrición.
hunger and
En
malnutrition.
América Latina,
In Latin
el
America,
8.4% de las mujeres se encuentran en situaciones de
8.4% of
inseguridad
females
alimentaria severa,
are
en comparación
severely
con el 6.9% de los hombres.
malnourished
En 10
in comparison
países,
to
el
males.
20%
In
de los
10
niños y
countries,
niñas más pobres
20%
sufren
of
3
children
veces más la
suffer
desnutrición crónica.
chronic
Las poblaciones
malnutrition.
indígenas sufren mayor inseguridad
Indigenous
alimentaria
populations
que las
suffer
no indígenas.
more
Y las poblaciones
malnutrition
rurales
than
más que las urbanas.
non-indigenous communities, as well as
Para que
rural
este cambio
communities in
pueda ser
comparison
real y
to
sustentable,
cities.
debe
For this
construirse
change to be
teniendo en cuenta el
sustainable,
rol de la
we need
mujer
to take
como
into account
crucial,
the role of women
así
as
como
something
considerar
crucial
a
in
todos
this
los
area.
actores
We also
involucrados
need to
y
consider
su
every
perspectiva,
actor, every
para lo
player
cual
involved
los
in this
invito a
situation.
escuchar
That's
la
why I
perspectiva de
invite
los
you to
actores
listen
que
to the
conforman este
perspective
panel
of some
y
of the
posteriormente
actors
iniciaremos un
that will be
diálogo
joining
entre
us in
ellos.
this panel and have a dialogue with
Doctora
them.
María de la Luz
Dr.
Iracheta,
María de la Luz Iracheta,
¿cuáles son las acciones que la
what
comunidad
are the
médica
actions
realiza o
of
debería de
the
realizar
medical
con
community?
una perspectiva de
What
género
actions are
para
you
apoyar de
trying to
manera
do
sustentable a
as
disminuir la brecha de la
in
desnutrición?
order to close the nutrition gap? Thank you, Dr. Roberto. Well, I think one of the most important things that we have is the responsibility we should assume as women, and also everyone that works in the health sector. We need to promote education and good nutrition habits. Pediatrics, we have the responsibility of taking care of the development and growth of children, that this growth is done in a harmonic and progressive way. Mexico has different programs, the ones that Dr. Roberto already mentioned, and these programs intend to raise awareness in the country and to grant easy access to food and to these nutritional programs. In this way, we decreased almost 40% malnutrition that affects the populations of our country. However, this could sound okay, but there's a long way to go yet. On the other hand, something that's happening right now is that as part of malnutrition, we're also seeing obesity as another problem. 35% of children between 5 and 11 years old are obese. 34.5% and 35% between 5 and 19 years old are obese as well. That means that we are the first place of obesity. This is worrisome, of course, at a national and international level. So I think the pediatrician is responsible for the programs that we are implementing. Prospera, Progresa, those are the names of the programs. Each government will change the names of the programs, but really they're the same. We need to build a support network so that women can be re-educated in these terms. And the pediatrician has the responsibility as well as the nurses, so that they need to measure kids, they need to do some weigh-ins so that they can monitor their weight and their health, and that we are able to diagnose at early stages if there's a curve leading towards obesity or malnutrition, malnourishment. I think all of us have a great responsibility in terms of food, because I mean, we say nutrition. Nutrition sounds like a big word, but you know what? Food needs to be adequate, balanced, and needs to include all the necessary characteristics so that kids that are not obese or malnourished, healthy kids, and that they are balanced. Thank you, Dr. Iracheta. Daniel, what do you think is the main challenge of the healthcare institution in our country regarding these issues? What can your company do in order to close the nutrition gap? What could you do with your collaborators, with the society? What are some of the barriers that we have? Thank you, Roberto. Thank you, Women's Forum. Good morning. Good morning, everyone, ladies and gentlemen. Well, you asked me two questions. First of all, healthcare system in Mexico. I think this is a completely fragmented system. In Mexico, unfortunately, we are at the top of the rankings in terms of obesity, and we are in the lowest rankings where we should go up, like in terms of health or the ratio of nurses per number of nurses per inhabitant. So this has to be a collaboration between the public and private sector in order to solve this issue. The president says that he wants to grant a universal access to healthcare. We all agree, but he doesn't say that the private sector needs to have a very special key role, and that is what we're missing. We won't succeed if we don't collaborate public sector with the private sector. So I'm just raising awareness here. Second question, what could private companies do? Well, as Fausto from Nestlé said, we need to work with our collaborators and with our customers, and at the end of the day with our population. In AXA, everything that Fausto said that they do in Nestlé, we do that in AXA as well. We have created two clinics for our collaborators for primary care, and I hope that someday we can also grant access to other Mexicans. Thank you.
And ¿cuándo y cómo pensar en el soporte nutricional en la
Silvia,
primera etapa de la vida?
How and when do we think about the first support in the early years of life? Oh, first of all, I want to say that I'm very happy to be here at the forum. I'm French, so Normally, I discuss these topics between the United States and Mexico, but honestly, I feel more identified here in Mexico. My heart belongs in here. Unfortunately, I feel more comfortable in English than Spanish.
So the first thing I want to say loud and clear as, you know, a person responsible for a company who is producing leche de bébé, so children milk, is that breast is best. When we speak about nutrition for babies, breast is best. Should be very clear. That being said, when we look at the facts, only 31% of the women in Mexico have decided to breastfeed their baby exclusively, you know, till the age of 6 months. 31%. It's quite low, you know, if you compare to some other countries in Latin America, like Peru, you know, we're speaking about 75%, so more than the double. So I think the question is, what can we do, you know, to encourage the mother to breastfeed? And here, I'm selecting my word very carefully, encourage the mother to breastfeed. I'm going to remove my CEO hat to put another hat, which is a personal hat, you know, as a mother and a woman and a mother of 4 children. We should speak about encouraging and not forcing. That's a different debate, but, you know, I think it's very important to stay in a society where the mother has the possibility to decide to breastfeed or not, and if she feels for emotional reasons or physical reasons that she cannot, we need to be able to respect her choice. But that's a personal comment, not... So, coming back to the question, how can we encourage breastfeeding? I'm sure, you know, you already have some answers. I've tried to list, you know, the different points that we can speak about. The first one is, as usual, education. It all starts with education. Education about the benefit of breastfeeding. Really explaining to the mom, to the young mom, that why it's better to breastfeed versus, you know, using something else. It's education about the way I should deliver the baby. Do you know that in Mexico, 41% of the mothers deliver their baby with a C-section? It's crazy, 41%, compared to a number which is a single digit, low single digit in a country like Northern Europe. Why that? I mean, that's not the debate, but, you know, clearly we know that C-section doesn't help for breastfeeding and doesn't help for future nutrition because it will create more allergy, you know, and as a result, you know, will impact the life of the babies later on. Beyond education, it's also about help. You know, I don't know, it's a question, sorry for the man, but it's a question just for women. How many of you have breastfeeded their babies? And we all know that it sounds completely natural, but gosh, at the beginning, it's not easy. It's not. It hurts. So you really need to have support, especially, you know, the first week, to go beyond the pain, to really, you know, understand that, yeah, maybe it's painful at the beginning, but it will become a real pleasure later on. So, you know, we really need to have a system which gives support to the young mom, you know, to understand how to breastfeed, you know, to have that as part of the curriculum of, you know, what the young mom is going through in order to be ready to deliver a baby, and have, you know, the right persons also in the hospital to help her, and so on and so forth, right? Beyond that support, you know, we also need to help also in the rest of the life to breastfeed. So here I'm speaking about breastfeeding room in public places, in offices. It's very difficult for a mom, you know, to pump her milk in an office, in a toilet. It shouldn't be the case. So, you know, we should really encourage, make it a law to have breastfeeding rooms in offices. We do, and you know, you need to have a comfortable place, a place where the mom can stock the milk, you know, so that it's safe. Another point which is obvious is maternity leave, longer maternity leave. Here in Mexico, you know, the maternity leave is 84 days fully paid, 3 months. It's not that bad compared to some other countries, but it's not that great. You know, even in Brazil, it's 4 months fully paid. But what is even more important is that the mom has the possibility, the flexibility to take unpaid leave, but still having the security that the job will be here waiting for her when she's keen to return. So that's something, you know, that we've tried to promote in our company. You know, we have longer paid leave, 4 months, but more than that, you know, we have the opportunity for the mom to take an extended 6 months period while being absolutely sure that, you know, the job will be there when she's back. And I think we need to move in that direction for breastfeeding. Now, that being said, if the mom decides not to breastfeed, the question is, what is she going to give to the baby? And here again, the numbers are quite frightening in Mexico. There is 1 out of 3 babies below 1 year of age who are consuming cow milk. And with all due to respect to Danone, we know that cow milk for infants below 1 year old is not right because it doesn't contain the DHA, the iron, you know, that a young baby needs, which is especially at this crucial age where, you know, the brain is still being developed. So cow milk is, you know, an issue. But unfortunately, you know, cow milk is not the main enemy. There is 30% of the kids below 2 years age who have energetic intake, which is far higher than what it should be. And why that? Because, I'm sorry to say, but there is these awful pictures of baby of 4 months having in their baby bottle this sweet, dark liquid that I'm not going to name, but, you know, that's the case. Babies of 6 months old, 1 year old are being given soft drinks in Mexico. So I'm not going to speak for far too long, but, you know, we like to say in our company that our battle is not breastfeed. I hope you got it. That's not our source of growth. Our battle is, you know, the cow milk, is soft drinks, it's the normal diet, which is unfortunately not enough, as you say, doctor, you know, not enough to bring the right nutrition element to the young babies.
Datos para el análisis profundo. Silvia, ¿cuáles son las acciones
what are
the
the actions that we can take in order to tackle the malnutrition and obesity problems that we have in Mexico? And also another question, how could we include society so that they can change their eating habits, especially taking into account the females living these problems? Good morning, everyone. Thanks a lot, Doctor, for your question. Thank you, Kiara, for including this relevant topic. We can say that in the last 100 years, the nutritional aspect has changed a lot. The safety in nutrition hasn't been very beneficial for society. We have now 2 million obese people in the world. So this is something that can worry us a lot. It's a concern we have in the industry. But we should not only be worried, but we should be occupied with this topic. From my point of view, I mean, I'm a mom, I have 2 kids, and back then it was very easy to tell them what to eat when they were small, because at the end of the day, you were the one putting the food in the fridge. But as they grew up, they started making their own decisions, their own nutritional decisions. So we need to inspire them and encourage them to make the right nutritional decisions, because it's very easy for people to eat instead of get nutrition or nourish their bodies. In Mexico, we're very indulgent. It's the second most indulgent country in the world. We eat whenever we feel like eating and whatever we feel like eating, and we give a lot of junk to our intestine to process. So Danone is now 100 years old as a company. We're celebrating this 100 years, and we're reflecting. Well, actually, this company was founded in Barcelona 100 years ago. They started with milk and fermented foods in order to cure some kids' problems, and these products were sold only in drugstores. After this 100 years old, we still have the principle of selling probiotics, fermented products, and using local ingredients. What worked for us 100 years ago cannot be what works for us nowadays. So we need to reinvent ourselves. The consumers want more. They are demanding more. We cannot tackle people that are obese and malnourished at the same time. We need to work with that sector. Women need to be very clear in terms of what should be eaten at home. I have a very supportive husband. I need to say that. Thanks to him, I am where I am. But let me tell you, I control what's in the fridge, what goes in the fridge. If I am 2 weeks traveling, when I go back home, I see some stuff in the fridge that I don't really agree. So I talk to him. Maybe there are more burgers than I would like to see. After 2 weeks traveling, he kind of takes over the fridge. But we are very responsible for what we put in the fridge and what we prepare in the kitchen. But we need to inspire our kids and guide them.
Doctor Iracheta,
how could we focus this support from the industry so that we can come up with this nutritional proposal, especially in the first years of a kid, and how to educate people in terms of what to eat or how to eat every single day? Well, I think there's something important here. Part of the responsibilities of the physicians is to educate patients. We focus on nutrition and they talk about macros and vitamins and things like that. And sometimes that sounds kind of foreign to some people, to some women. But what they do understand is nutrition. So I think if we make a big effort, industry and the medical society, pediatricians, we can re-educate our country regarding food. There are no right or wrong foods. You need to learn how to eat correctly, how to include every single thing in your diet. You can be indulgent sometimes. Nothing bad will happen. And now the percentage of teenagers, some of them are anorexic, because they have low weights, because they feel that there are foods that they should never touch. And this is wrong. We need to teach people that they could eat everything as long as it's a balanced diet, and that the diet should be green mainly, fresh foods, and sometimes they could indulge in something that they can that they can acquire at some convenience store. But yeah,
Daniel,
re-educate
¿cómo
people,
las
definitely.
políticas de salud se pueden
And the health
entrelazar
policies
con las
or
propuestas de la
regulations could
industria y también
also
con el apoyo que tenemos que dar
somehow
al sustento
be
nutricional
interlinked
desde
with
primeras
the
etapas?
industry.
A ver, lo que es interesante en este panel es que
What's
todo lo que
interesting
estamos diciendo
in
creo
this
que
panel
no habrá debate, estamos de acuerdo.
is
El
that
diagnóstico está
I think
aquí, lo que hay que hacer
we're not
está
having a
aquí,
debate.
en
The
donde no sabemos
diagnosis is
cómo
here.
cambiar las cosas
We
es
already
en la
know the
ejecución,
reality.
cómo ejecutar
The only
quién ejecuta, ¿no?
space for
Entonces, ahí
debate is
creo que
how
nos
to
tenemos que poner
execute
de
these
acuerdo. Y a mí me gusta
decisions
mucho
or
el tema
these
de la educación,
actions.
¿no?
I
Nosotros
like
como
that
aseguradoras, pues, siempre
topic of
hablamos de
education.
educación
We as
financiera,
insurers
deberíamos
talk
hablar
about
también
financial
de
education, but we could
educación
also
de
talk
nutrición,
about
¿no? Y
nutritional
esta tiene que
education.
empezar en las escuelas.
And
Estoy
this
totalmente
need
convencido. Tiene que
need
empezar en
to
las
start at
escuelas
school,
de manera
at schools.
muy padre. Pero en donde nosotros podemos intervenir
Where we could
es, y
also
vuelvo a
have
este
some
tema,
kind
es
of
la atención
action
primaria.
is
En México,
primary
la
care.
atención primaria
In
no
Mexico,
existe,
primary care does not
porque
exist,
no me dejarán mentir, pero si
because
ustedes van a un hospital,
if you
van
go
cuando
to a
tienen algo
hospital,
grave, porque las filas son
you
tan
go
largas, las esperas son tan
only
largas, que si
when
no
you're
es algo grave,
dying,
pues
when
no
you
van.
have something serious,
Quizás
because
vayan
if
a
you
un
have something
consultorio de
minor, they
farmacia.
won't
No
provide
puedo
attention.
pronunciarme aquí
Sometimes
sobre
you
la
could
calidad,
go
pero
to
ahí seguro
this
que no van a
pharmacy
recibir una asesoría
medical
de
counseling,
profesionales,
and
bien
I'm
sean
sorry, but I
médicos
don't think
o
that's a
nutrólogos. Y
professional
aquí es, de
care.
nuevo, en donde tanto el sector
So
público
the
como el sector
public
privado
sector and the
pueden
private
y deben
sector
contribuir a
can
que
and
tengamos
should
un
contribute
verdadero, una
so that
verdadera
we can
atención
have a
primaria en
real
México,
primary
que
care in
podamos
Mexico,
prevenir
and
muchísimo
we can
más, que
prevent
podamos
a
educarnos
lot of
para que
problems,
este problema
and we
tan
can
grave,
educate
pues, tenga una
ourselves
solución.
in order to avoid serious problems, and we can
Muy
find
bien.
solutions.
And how do you think about the problem of the obesity?
Yeah, so it's interesting, in our company, we also do powdered chocolate, to put in the milk. And it's very, very difficult to change things. You need a lot of courage, in the industry if you want to change things. But once you've changed it, it stays. Let me give you, again, I like to ask questions. So I assume all of us drink coffee. Who's drinking coffee with sugar? Who's drinking coffee without sugar? Okay, so that's interesting because I don't know about you, but clearly when you switch to coffee without sugar, it's absolutely impossible to drink again coffee with sugar. You find it absolutely disgusting. But, you need to be educated on starting to drink coffee without sugar. And I think, it's the same for any taste. I'm an expat here in Mexico, and I'm desperately trying to find yogurt without sugar. Because, we are used to that. So my point is, when we deal with obesity, Mexico and Latin America in general has a big issue, which is that everybody is used to this very sweet taste. And again, we have to speak about education. If you want to change that, you need to start at very young, very early age. Now, we industry, what do? Each time, I'm sure you have the same issue, each time we try to launch on the market a product with less sugar, it's rejected by the consumers. So that's tough, because we're here to do business. So it doesn't mean that we are not trying to do anything, but you need courage, you need continuity. We've just launched variant of choco milk and calcitose with 50% less sugar. I hope it will work. But, you know, it has to be accompanied with education, with, you know, program with the kids, with the moms, to secure that, you know, even when we speak about infant milk, the mom has usually the tendency to test the milk, you know, of her baby. And if it's not sweet, she will say it's not good, but it shouldn't be sweet. So, you know, that's something which requires a lot of passion, which we have, a lot of continuity, a lot of effort, together with stricter regulations, because, you know, we need to be pushed as an industry to do more, to try and change things.
Las
Esto,
cosas.
muy bien, hace pensar que tal vez
Yeah,
la
this makes me
brecha
think that maybe the
nutricional,
nutritional gap
esa es la que todavía tenemos
is
un
the
problema
one
enorme,
that
porque la
needs
brecha
our
alimenticia, a lo
attention.
mejor sí comemos,
Because we
pero
definitely
no tenemos
eat,
los suficientes elementos para
but we don't
para
have the
comer o nutrirnos
necessary
bien.
elements
En la
for
última
the right
encuesta
nutrition.
nacional de salud,
In
refieren
the National
deficiencias de
Institution
hierro,
of
por
Health,
ejemplo, o de vitamina D,
we
que
can
van allá
discuss topics like
del 50,
vitamin D,
60%, depende de la zona que se estudie.
and that depends on the area
Inquieto por eso
where
acabo
we're
de terminar
conducting
un
a
estudio
study,
precisamente en el estado de Puebla,
as well as
en
iron.
donde esto
For
fue
example,
peor
in
porque
Puebla
ahí
State,
encontré que había unas deficiencias tanto en las madres gestantes como
I
en los
saw
recién
that there
nacidos,
was a
cerca del
deficiency of
83
iron,
al 93% de
83,
deficiencia.
93% deficiency of vitamin D and iron. So how could we close this gap of nutrition? Well, first of all, raise awareness to have people know about this. It's a nutritional aspect more than eating habits. Thank you, Carlos. And also thank you for mentioning the sugar topic. We're talking about also intestinal health, what we eat and the nutritions or nutrients that we can absorb. On one hand, we don't eat what we have to eat, and then we eat what we shouldn't eat, and our body is not really absorbing. 95% of Mexicans refer or claim to have some kind of intestinal problem. If I say over 90%, I can say everyone suffers from intestinal issues, maybe because you travel, maybe because you eat in a certain way. So what we eat, we need to make sure that whatever we eat is assimilated correctly, the nutrients. In this 100 years of the company, we have developed 1,800 ferments that we have developed, but we only use a fraction of this. So celebrating this 100 years, we open this collection of ferments so that they can be used for research, and we could apply those for any other products and apply these strains, for example, for regenerative agriculture, in order to have healthy products, so that we can have healthy populations, so it's a whole ecosystem. If you commit to only one topic, like sugar, well, yeah, you could have a reduction of sugar in everything that we do. Yes, it's complex, and we do it, of course. 15% of our sales are new products per year, and we try to lower levels of sugar, and we try to include more probiotics in order to change this nutritional aspect. But we need to look at it as a complete ecosystem. Okay, we're about to finish with this panel. I would like our panelists to give us a final message, a brief message. Please, Dr. María de la Luz Iracheta. Yeah, I think the role of women is very important in terms of nutrition and a balanced diet. They are the ones deciding what to buy. They are the ones deciding how to eat or what to feed to their families, and they're the ones with the greater responsibility. The pediatrician needs to be a consultant, needs to provide advice and to have preventive or provide preventive medicine for children. Also, I believe that we need to focus on education, education, education. If we don't have that educational background in order to understand that we are what we eat, then it's going to be very hard for Mexico to understand the nutritional gap and face these problems of obesity and malnutrition. Thank you.
Daniel.
Thank you, Daniel. Okay, I hadn't talked about women. I was saving it for the final message. First of all, I want to mention all these women that work very hard at AXA. I want to homage them because they work very hard, not only in AXA but in other sectors. They work very hard, and they work also very hard at home because men, usually we don't work hard at home. So I hope that you're clapping for the first comment and not the second, talking about males being inefficient at home. Anyways, we know that we have the rate of obesity, hypertension, etc., the highest rate in the world. But you know what? In women, this rate is even higher. And this is not possible. As the doctor told us, women are the ones in charge of the decisions, what to eat, what to feed to their families. So really, it's an urgent matter to re-educate families and women, Mexican women, so that they can take care of themselves better, and that we don't have this expense that is so high, and maybe you could use private insurers. In AXA, we love paying casualties for the public sector, but there should be a universal access to healthcare, but not only for serious conditions like cancer or heart problems, but also for primary care. So we need to have that commitment, and that is what we are trying to achieve, so that that collaboration between the private and public sector works for women and for Mexican population.
Totalmente de acuerdo,
I agree
Solamente hay
completely.
que recordar que el hombre, la única
We
manera que
just
tiene para
have
llegar
to
a este
remember
planeta es a través de una mujer.
that males, they are born from a woman.
So I think it's very difficult. So as usual, you know, there is not one simple solution, and we won't be able to find a solution if we don't have a multi-dimensional approach. So it's very important to have the politics with the regulation, with, you know, what they do for poor people, the industry, the doctors, the school, the parents, you know, all working together to try and change things. And as usual, you know, the woman is, especially in the case of the nutrition, at the center of these multidimensional systems. And as you say, Doctora, you know, education is like the key word. So not to end up on a too pessimistic note, I think what is great about education is that usually with education you can solve more than one problem. You know, there is a kind of virtuous cycle that you can start to initiate. I've not mentioned it, but teenager pregnancy, unwanted pregnancy is one of the worst issues of Mexico. We are worst in class. But it not only creates issue in terms of pregnancy, but, you know, nutrition. I mean, when we discuss with doctors, they very often say, I cannot advise this young girl to breastfeed. She's herself suffering from anemia because she's so young and she doesn't have enough to eat. So education at the center of the solution, and hopefully will help to solve different issues at the same time.
Gracias, Silvia.
Thank you.
En
Silvia.
temas tan complejos,
these are such complex topics. And of course, there is no one simple solution. We need the collaboration. We need to make an effort. Companies, consumption, what we have done is enough? Of course not. We need to evolve the nutrition. We need to live and redesign the nutritional programs of the future. If we want to earn consumers' trust, then we need to do things differently. Big brands, because now we are expecting or demanding transparency from these big brands. I think we need to involve different actors and not to lose hope, because every single action contributes, even if it's a small action that is going to make the difference. Another thing is that it's very important to be aware that every time you choose what to eat, you're choosing what kind of planet you want to have. So definitely, your eating decisions impact the world. Thank you very much.
Silvia. Pues a manera
Thank you.
de conclusión, es indudable
To
que el
finish
papel
with
de la
this
mujer
panel,
es
we can say
fundamental para
that the role
coadyuvar
of
este
a
problema,
woman
ya que es el
is
centro donde se
crucial
desarrolla la
in this
educación,
topic
la alimentación y la salud.
of
La
health and
colaboración entre
nutrition.
los actores de servicios públicos y
Collaboration
privados
between
favorecerá la
public
atención
and
a
private
esta doble
sector,
carga alimenticia, que
industry,
es la desnutrición y la obesidad.
etc., is key also to
Comprendiendo
tackle
la
obesity and
multicasualidad y
malnutrition.
la interrelacionalidad es que es parte del
Talking
problema,
about
pero también es parte de
the
la solución.
relationship between all of these
La atención del
actors,
problema de la
we could
mala
find a
nutrición
solution
debe de observarse y
if
atenderse
we
desde un enfoque
collaborate.
multidimensional
We need to
donde
address
participe el
these
sector
problems from a
gubernamental, la industria privada,
multi-dimensional
las escuelas
approach,
y la comunidad médica en su conjunto,
working at
especialmente
schools,
en la
working,
prevención y la
re-educating people at
atención
home,
primaria
at
de la salud,
schools, providing
resaltando
primary care,
fundamentalmente la educación.
health care for everyone.
La mujer es la responsable de iniciar este
Females
proceso
are
desde el
responsible
hogar, con la
of starting
exposición a
this process
principios,
at home
valores y
through
buenos
the
hábitos,
decisions, values
orientando y favoreciendo una
that
buena
they're
conducta
going to be
alimentaria
passing
y de
on to
salud
their
personal.
families and through their own
Y como
personal
mencionó
health.
Brigham Young por
And
allá en 1800,
as
educa a un hombre
I
y educarás a un
heard
hombre,
somewhere,
educa a una mujer y educarás a toda una
educate
generación.
one man and you will educate
Gracias.
one man, educate one woman
Agradezco
and you will educate a
A
generation.
los participantes
Thank
en
you.
este
Thank you
panel,
very much to the
agradezco a la
participants of this
coordinación la
panel.
gran
I
oportunidad
really
que nos ha dado de
appreciate the
dirigirnos esta
opportunity
mañana.
of being here
Muchas gracias.
discussing these important topics this morning. Thank you.